Welcome, Dr. Boyd. We're here to talk about Airway Palooza, and thanks for taking some time out of your busy day. I know you're helping save literally children's lives today. So I don't know how many kids you're seeing in one day, but let's talk about the Airway Palooza and how it's coming up December 9th and 10th in Savannah, Georgia. I'm so excited for you to kick off the day on December 9th, where we're going to focus on children. And what I really wanted you to do was kind of level set with all this research that's out there beyond the craniofacial, I'm going to say respiratory complex, as you always have coined it. So let's talk about what you're going to be talking about, just a teaser, if you would, and then why you're excited about the Palooza coming up in Savannah.
It's just a whole nother, that's a Midwestern term, group of people that you've assembled to speak. It's just oh my gosh, I'm sorry, they're calling me.
That's okay. I know you're busy.
Yeah, but that's okay. I made time for this. Is it the panel of presenters that you've assembled, Lauren? We all complement one another. We don't rehearse together or anything, but our talks always come together. It's just a single thread. Chronologically, you had ordered such that we're going to deal with pre-adults first. Most people call them children, but they will become what the second day is about, and that is adults. And I'm real excited more than ever. This is material that I've covered time and time again with different audiences. But what has happened in the last 3 or 4 months, we've become very focused for a number of reasons. We've been asked to publish book chapters and some articles and some other activities that involve really help people defend themselves. It's like when I do a consultation with parents and say their 4-year-old is just, snoring and dark circles under their eyes and not doing well in school and behavioral problems. Well, I want to expand their jaws. Well, how come? Because they're too narrow. They need expanding. Well, they have to defend themselves to their spouses sometimes, to their neighbors, to their relatives. This is just something that fell out of the literature. This started 100 years ago. This is in medical and dental literature going back to the late 19th century. We found one article that is actually going to be used in a very official capacity by Dr. Leroy Johnson. And I think maybe we want to send this out to everybody to just read this article. 1921, the face evolved for the purposes of mastication, chewing, and respiration, breathing. They knew this 100 years ago. The face is connected. The jaws and face is connected to the airway. You can't separate them. And again, so we're out, we want to optimize structure for children as early in life as possible so they can become lifetime nose breathers. It's that simple. It also yields the best occlusion, the best presentation of the smile. These things are set up very early, the foundation. And then a new concept that has come into the healthcare lexicon is something called health span. Lifespan, that's life expectancy at birth. Well, in the last 100 years, it's gone up almost 50 years. People live to be 80 years old now, but their health stinks, usually about in their 40s, if not sooner. Health span has to do with establishing in early life a child's ability to not only sleep and breathe well, but to have better self-control. If you Google the term self-control in health span, watch what comes up. It's an amazing study out of New Zealand called the Dunedin, D-U-N-E-D-I-N. And little kids before 11 years old, if they have the capacity, the wherewithal to sleep and breathe through their nose and to have, restful sleep hygiene, they're going to live longer and they will live better. And that's something you can say with a reasonable degree of scientific certainty now because of the Dunedin study. So That's what I'm most excited about, is to bring that up at Airway Palooza and complement all the other speakers that are going to be there.
Well, thank you so much. We're excited. And whenever I speak with you, Dr. Boyd, it's so wonderful because your material is always fresh. It's like there's always additional research. There's always more to learn. And there's also more to uncover, like you just saying, this paper from 100 years ago, you know, the literature that's already there. We just have to really bring it to the forefront to implement it. So kudos to you for being the champion of this and spreading that, you know, across not only the dental world, but really in general. I know a lot of people are hearing your message throughout the world on so many different social media platforms. So kudos to you for really championing this. I can't think of a better person to kick it off, but I'm really excited because I do want to share with everybody all of the speakers. But I think I'm on the whiteboard.
No, I can see the Harbor Golf Resort.
Oh, you can. Wonderful. Perfect.
Yeah,
So I'm just gonna have to go to my monitor here. So like we do have our keynote speaker, James Nestor, and it's funny how we didn't even like bring him up because we're so excited about all of the other speakers who on their own could be a keynote speaker per se. But you know, I have a call with Mr. Nestor in a couple of weeks, and we're just going to formulate a keynote that's really going to be unique to this group. So I'm really excited about that. And you can see here kind of the cast of characters. And like you said, Kevin, it's going to, everyone really complements each other. Here is the itinerary here. So we have, you're going to kick it off, followed by Ben Moralia, and then we're going to have to talk Mayo. So those are Carice and Brittany are our faculty members, and Dr. Scott Siegel is going to give us some updates and some research as well. And Dr. Brett Christensen, he has this data-driven orthodontics using rhinometry, which I know you're a big fan of, Dr. Boyd. So we'll see his wonderful results. Dr. Lauren Ballinger was just on the other day, and she's going to really talk about the art of influencing kids and the parents, and how sometimes it can be scary to start if you've never started before. So she's going to give us some great tips and tricks. Your pal in action, Dr. Darius, about compelling conversations with PCPs, because he is an MD. So from his perspective, you guys will learn a lot. And Dr. Susan Maples just has a wonderful book, Brave Parent, and she's going to talk about being a brave airway dentist. Dr. Simmons is going to kick off our Saturday the Adult session with connecting the dots and all about TMD, bruxism, and airway, how it all correlates. So all the dentists out there who have their patients in night guards, you all have airway patients. So Dr. Michael Gelb will follow with TMD, the prequel to airway ortho. And then Dr. Christensen's going to share his adult cases, because there's a lot of myths out there that you can't expand adults. And he's going to show you with proof that yes, you can, also with data driven cases. Dr. Scotty Bolding is going to talk about MMA collaboration and some of the cases he's done with Dr. Moralia. And then Dr. Carstensen is going to talk about updates in the ADA and really how exciting it is right now to be a dentist and to dive into airway to truly make a difference in your patient's overall health. And Dr. Scott Province is going to join us later tonight talking about his airway journey. Because Kev, he just took this course, Ben's course, about 2 years ago now, maybe not even 2 years in February. And his main focus is this now, and he's treated so many patients in just this short time. So the moral of the story is don't be afraid. Anyone can do this once you apply yourself. And then we're going to close it out with James Nestor. I'm also excited that it's in Savannah. Have you been to Savannah yet?
When I was 15 years old, I was there.
Okay, so it's a wonderful city to explore. There's a lot to do. It's going to be in December. It's going to be 70. So to me, it's just a win-win all around. But really what makes it really special are the group of speakers that we're having, but more so how they're going to collaborate with all the attendees. The wisdom they're just going to learn from the social events that we're having under one roof is going to be probably the most important takeaways for them, is just really getting to that intimate time with all the speakers and all of the people who are in the same line of work and doing the same type of mission, if you would, airway health. So Dr. Boyd, I know you're busy, you have patients to see. I do appreciate your time, and I look forward to seeing you in Savannah. I think that's the next time I'm going to see you.
Likewise, Lauren, I love working with you and Ben. And This is going to be great.
It's going to be great. And you have a VIP link that everyone can, if they want to sign up, they get VIP savings. It'll be in the chat, but it's airwayhealthsolutions.com/AP Boyd, BOYD. So take advantage of that. Thanks again, Kevin, and I will see you in Savannah.
Okay, my dear. Have a great one.
Take care.
Okay, see you later. Bye-bye.
Bye.